Today's podcast is a continuation of our series exploring the safety of non-sugar sweeteners in both food and beverages. In 2022, the World Health Organization conducted a systematic review of the most current scientific evidence on the health effects of non-sugar sweeteners. This analysis of 283 studies reveals that non-sugar sweeteners can impact health conditions such as cardiovascular disease, type 2 diabetes, adiposity, bladder cancer, and preterm birth. In 2023, the WHO released a guideline on the use of non-sugar sweeteners based on this 2022 review. Welcome to the Leading Voices in Food podcast series. I'm Kelly Brownell, Professor of Public Policy at Duke University and Director Emeritus of the World Food Policy Center. It's my pleasure to welcome Dr. Jason Montez, a scientist with the World Health Organization and technical lead on the systematic review and guideline, and the director of the Department of Nutrition and Food Safety at the World Health Organization, Dr. Francesco Branca. Jason and Francesco, thanks so much for being with us.
Thank you. Pleasure.
Yes, pleasure. Thank you.
Well, this is really important work, so let's get right down to it. So, Francesco, let's begin with you. Would you help our listeners understand why the WHO, World Health Organization, developed this guideline, and what do you hope to accomplish now?
So our interest in the topic really came after the release of the WHO guideline on sugar intake in 2015. And that recommendation was, of course, to reduce the amount of sugar to less than 10% of energy, better if less than 5% for weight control and for dental hygiene. And at the time, there was an interest, particularly from the food and beverage manufacturers, to consider the use of non-sugar sweeteners as part of the interventions aimed at reducing sugar intake. And this has basically been taken up by consumers since. So the availability of non-sugar sweeteners has increased. So we thought it was important to review the evidence in a systematic manner and see whether this move was actually achieving the intended aim to control weight gain particularly. So we thought looking at non-sugar sweeteners use through the WHO guideline development process. Our hope is, first of all, to make sure that people achieve their intended health benefit, but also to avoid an unintended consequence on health.
I remember how much impact that report on sugar had back when WHO released it. And boy, the same thing seems to be happening with a guideline that we're talking about today. So Jason, can you walk us through the key findings of the systematic review?
Sure. So the top line results of the systematic review are that in short-term randomized controlled trials, RCTs, mostly lasting 3 months or less, those consuming higher amounts of non-sugar sweetener compared to lower amounts or no non-sugar sweetener had slightly lower body weight, so around 700 grams, and slightly lower BMI, about 0.2 units. However, in long-term prospective cohort studies, many with several years of follow-up, body weight was either unchanged or greater in those consuming higher amounts of non-sugar sweeteners. And associations were also observed between non-sugar sweetener intake and increased risk of type 2 diabetes, cardiovascular diseases, and premature mortality. For diabetes, for example, is about a 25% increase in risk. In RCTs, markers of these diseases, such as blood glucose, insulin cholesterol, blood pressure, that were largely unaffected by non-sugar sweetener use. In addition, we saw an increased risk of bladder cancer, and these were coming from case control studies, and it was primarily driven by saccharin, and also 25% increase in risk of preterm birth in pregnant women. In terms of body weight and the risk of non-communicable diseases. So we essentially have these seemingly opposing results between the short-term randomized controlled trials and the long-term cohort studies.
Those are really concerning findings. And, somebody in their own calculus might say, well, I'm willing to accept the risk for those things as long as it helps with my body weight. But you were talking about greater weight in people using the non-sugar sweeteners.
Right. So in terms of long-term impact on body weight, there's not a lot of evidence. And of course, this is all coming from cohort studies, and cohort studies have caveats associated with them. But what we see in those studies is it's either really not much of an impact, but we did also see some increased risk. For example, there was an increased risk of incident obesity in one study. And that is they looked at people at baseline without obesity, and they're using, standard WHO cutoffs. And then they followed them up over time. They counted the number of people who transitioned over the obesity threshold, and they found that it was higher in those using non-sugar sweeteners. So there is some evidence, but I think we need additional evidence to be really sure about that in the other associations.
So, Jason, you alluded to this earlier, that there were differences in the health outcomes reported in randomized controlled trials versus observational studies. Can you explain why this might be?
Yes. So it's a bit nuanced, and I think a lot of it has to do with the nature of the studies. So to really understand this, we need to unpack that high-level evidence a bit. And I think I'll start just by talking about maybe the elephant in the room, and that's reverse causation, because it's been frequently invoked as a reason for the associations observed between non-sugar sweeteners and the body weight and disease outcomes. Basically, reverse causation suggests that those already at elevated risk of disease initiated or increased the use of non-sugar sweeteners because of their risk status, rather than non-sugar sweeteners leading to the increased risk in otherwise healthy or low-risk individuals. And that would make sense in this case. However, those who conducted the individual studies that we included in the review, they were also well aware of the potential for both reverse causation and residual confounding. And most of them really went to great lengths to minimize the possible interference of these phenomena. They adjusted extensively for confounding variables, all the lifestyle variables. Quite often they adjusted for other dietary variables. They looked at body weight, they stratified. They did sensitivity analysis where they would limit the analysis to individuals with normal body weight. They also removed from the analyses, in some cases, those at risk for disease at baseline. Many of them did a sensitivity analysis where they excluded the first several years of assessing the outcome, just to make sure that someone wasn't already really at risk and developed a disease right away was not part of that. In some cases, the effect was attenuated, but for the most part, the associations were not affected. They remain. Certainly that's the case for type 2 diabetes. So I think that reverse causation might have contributed, but really the lengths that the study authors took to address it, I think, calmed us a bit in terms of whether or not we were worried about it.
It's very helpful to know that. We've gone for years and years thinking that these things are safe and at the worst have neutral effects. And now the studies are showing they have negative effects. And partly it's just because the science has marched ahead. There are many more studies now. People have been more careful with the design of the studies. More sweeteners have been studied. And this seems like just kind of a natural progression of the scientific process.
Yeah, that's how it works. We continually add. There's still a lot to look at. I think in terms of, again, the differences, another really important thing to remember is that in the RCTs, a variety of interventions were employed. A lot of the studies took people who were consuming a normal diet and they just gave them, for example, a sugar-sweetened beverage or non-sugar sweetened beverage and wanted to look at what the effects of a sugar-sweetened beverage are. Very few actually looked at individuals who were habituated to sugar, mostly sugar-sweetened beverages, and then asked them to replace the sugar with a non-sugar sweetener. When you look at just those small number of studies, the results really get attenuated for both body weight and for BMI. So that's another reason why, if you look at it that way, the results between the long-term and short-term tend to gravitate towards each other. And then one last thing, I don't want to overdo it here, but it is important. There are likely big differences in terms of how non-sugar sweeteners are used in these highly experimental randomized controlled trial settings and cohort studies, which are really more like real world use. So in a randomized controlled trial, you're instructed to do this or that, drink this, take that. You get quite a bit of support from the study team. You'll get counseling, follow-up, et cetera, et cetera. And everyone really, they know they're in a scientific study. Quite often they actually know which arm they're in. Whereas in a cohort study in the real world, people use non-sugar sweeteners in a variety of ways. Sometimes they do it as a conscious replacement for sugars, but quite often they just consume beverages containing non-sugar sweeteners or foods containing non-sugar sweeteners because they have a diet label on them and they just perceive that those types of products just to be healthy. Sometimes they use them as a way of having something sweet or otherwise something that maybe they shouldn't have later on. And so it's much more complex in the real world. And obviously, the real world is how these things are used. So how they're used also can contribute to these differences between what we see in, again, highly experimental randomized controlled trials and the real world.
So how do these non-sugar sweeteners cause these negative health effects?
We don't know for sure. Let me just say that up front. We have ideas. Scientific community has ideas. A lot of mechanisms have been put forth to explain how this might be happening. And a lot of them are actually linked to the fact that the expression of sweet taste receptors, they're expressed in the mouth, obviously. That's how we perceive things to be sweet. But they're also expressed elsewhere in glucose sensing cells, such as the gastrointestinal tract and pancreas. So there are a number of different ways that this might work. So there could be effects on taste perception, sweet taste preference, thresholds of sweet taste sensitivity, eating behavior, so it impacts on hunger and appetite. There could be other neural responses. There's this whole discussion about the hedonic response to any sweet taste. Also, there might be release of metabolic hormones and other biological molecules in response to non-sugar sweetener intake. And then, of course, there's a lot of buzz around potential alterations to the gut microbiome, which is a really interesting area, but there's a lot of understanding still to be gained there. And then also, as noted, in terms of potential mechanism, it could be that the behavioral component we just spoke about in terms of how people actually use non-sugar sweeteners in the world, that could also contribute to the association between non-sugar sweetener use and body weight and disease outcomes.
A vast number of effects happen once these things get into the body. So, Francesco, let me come back to you. So what is WHO recommending? And I know some recommendations that have been made are conditional. What does this mean?
So the WHO recommendation reads, WHO suggests that non-sugar sweeteners not be used as a means of achieving weight control or reducing the risk of non-communicable diseases. It's a very simple one. It's basically saying that you're using the sweeteners, but they are not going to help you in weight control or reducing the risk of that related non-communicable disease. So, Kelly, you said earlier, would I take the risk that potentially is associated if I knew that this would benefit my weight? But in this case, what we are saying is, well, look, it's not going to benefit your weight control. And we're leaving it there because the purpose of this was particularly to look at weight control. We weren't looking at other aspects of safety, which is actually the task of other bodies, although we had to consider in the recommendation what we call the balance of benefits and harm. So here, the recommendation was clearly to say, well, you shouldn't use it because there's no demonstrated benefit and there might be some harm. Now, WHO can make two types of recommendations. So recommendation can be strong or conditional. The decision of whether to go for strong or conditional is based on a number of factors: certainty in the supporting scientific evidence, the balance of desirable and undesirable consequences. So strong recommendations are the recommendation for which the WHO guideline group is confident that the desirable consequences of implementing the recommendation outweighs the undesirable consequences. So in most situations, this would be something that government can take on immediately and use in their policy making. A conditional recommendation is a situation where the WHO guideline group is less certain about that balance between the desirable and undesirable consequences. And therefore, we are basically saying you need to consider the context and then decide what to do with this particular recommendation. So in this case, why did we go for conditional? So there is an element related to the balance and the evidence that Jason described earlier on. There's also an issue about short-term versus longer-term consumption. We have been trying to explain why not using does not create a problem. And the action depends on also the context of use of this particular product. For example, the levels of consumption in different age groups in the population. So in a sense, our understanding of the issue, which is still not complete. So we believe that we need to have more science on the topic. So we decided to take a bit of a conservative approach here. So that's why we end up saying conditional, which means we still recommend not to use non-sugar sweetener, but in terms of making use with this recommendation, we would like governments to also do their own assessment on how to translate this into policy practice.
So, Francesco, on one hand, we have sugar being a bad actor, and now the replacements for sugars can be bad actors. So how does this get balanced out? Should people go back to sugar? Should they just get used to things being less sweet? How does this work?
So definitely people should not go back to sugars because we know the consumption of free sugars has been linked to unhealthy weight gain, type 2 diabetes, cardiovascular disease, dental caries. So we definitely maintain the recommendation that we should limit free sugar intake. But unfortunately, non-sugar sweeteners are not producing a good benefit if we replace them with sugars. What we're saying is that both free sugars and non-sugar sweeteners should be limited. So yes, indeed, we would need to adjust our own taste to consuming products which are less sweet. And we should also ask the producers to reduce the sweetness in their product.
So Jason, do you have some thoughts you'd like to share about this?
Yeah, again, from a scientific evidence standpoint, it's interesting. If you look at the literature, you look at the studies, I mean, we have lots of studies now and a lot of systematic reviews and umbrella reviews, and that's really tried to make sense of all of this. But if you look at some of the impacts, associations between sugar intake and diet-related non-communicable diseases, especially type 2 diabetes, you look at the actual magnitude of the associations, the increased risk, they're really in line with what they are for non-sugar sweeteners. And in fact, some recent modeling published in 2022, again, modeling in the prospective cohort studies, shows that when you replace sugar with non-sugar sweetener, you basically end up with a no result, which means that non-sugar sweeteners, at least in terms of type 2 diabetes, are just as bad for you as sugar-sweetened beverages. So these are all beverages. So it's interesting that we have to keep in mind that they may both be bad actors, as you indicated, Kelly.
What an amazing picture. Francesco, so do you think that non-sugar sweeteners should not be used as a harm reduction mechanism to help people reduce their sugar intake?
Yeah, that's what our recommendation basically says. And we're encouraging individuals, but also government to think of other ways to reduce sugar intake that does not require the use of sweeteners as a replacement. And there are ways to do that. I mean, certainly there are unsweetened variants of the same food or drink. There are alternatives in dietary patterns. I mean, you don't necessarily have to have a dessert at every meal. You can have fruit. We know that the fruit sugars do not have the same metabolic effect as free sugars. We know that, for example, certain countries have, like in the UK, they've been given option to companies to use sweeteners instead to avoid the sugar levy. Probably we would ask those countries to have an assessment of what has happened and see whether that policy is still a useful one or it should be revised.
So, Jason, I'd like to ask you about diabetes. So, does the recommendations apply to people with diabetes, and can people with diabetes use these non-sugar sweeteners?
Yeah, Kelly, that's a question we are getting a lot of. So our guidance really is for preventing the development of disease and not for treating or managing existing disease, including diabetes. In terms of the process, making recommendations for preventing disease is very different than making recommendations for managing disease. So different scientific evidence needs to be reviewed. In the case of diabetes, some of the evidence is overlapping, but we really do need to look at a different body of evidence, and a different assessment of potential risks and benefits needs to be made. And this is all in the context of a larger plan of treatment, which may also include medication and other lifestyle changes. Therefore, managing disease requires greater input from clinicians. Something else to remember is that individuals without diabetes do have the option to include some sugar in the diet when something sweet is desired. But for many with diabetes, this isn't really an option. With that said, individuals with diabetes can certainly manage their disease without the use of non-sugar sweeteners. However, such decision really should be made on an individual basis and only in consultation with one's healthcare provider.
So, Jason, let me ask you a question about stevia in particular. So there's some thinking that because it's natural, unlike the artificial sweeteners, it's somehow different. So why doesn't the recommendation make distinctions between different non-sugar sweeteners?
That's a great question. Although all non-sugar sweeteners have unique chemical structures and consequently may differ in their sweetness intensity, organoleptic properties, and routes of processing by the body, we don't make a distinction in our guidance between individual sweeteners or between so-called natural sweeteners like stevia and artificial sweeteners. And this is because all sweeteners, including sugar, use the same biological pathway when it comes to how we perceive them as sweet tasting, so the sweet taste receptor I mentioned earlier, and consequently how they might impact weight and risk of disease. So also relevant is the possibility that we discussed before, which is that people may use these in ways that promote weight gain and disease irrespective of what type of non-sugar sweetener is being used. We feel that the evidence for a class effect is sufficient to include them together in our recommendation.
Okay, that's very helpful to know. So, Francesco, some organizations, for example, the Food and Drug Administration in the U.S., have declared over the years that these non-sugar sweeteners are safe for use. If those organizations feel they're safe, then why is WHO recommending that they not be?
In a sense, it's a different issue. Before any of these compounds is used in food, it has to go through this safety assessment. You mentioned the Food and Drug Administration. FAO and WHO are managing a joint expert committee on food additives, which is providing advice to the Codex Alimentarius. And all these bodies, basically, what they're saying is they look at the toxicology of the products, and they use animal studies. In some cases, they look at human studies, but they're basically looking at acceptable daily intakes that provide usually short-term impact. So we're also encouraging these bodies to consider longer-term epidemiological studies to look at other kinds of effects. For example, there is at the moment a big debate going on because both the Traditional Agency for the Research on Cancer and the JECFA are looking at the safety of aspartame and considering, for example, certain longer-term epidemiological human studies. So these bodies are talking about certain aspects of safety and looking at the very high levels of intake. Just to give you an example, at the moment, the acceptable daily intake for aspartame is about 40 milligrams per kilogram per day, which is for an average individual 2.8 grams. And that's about what you would get from 14 cans of commonly consumed drink. That's a lot. We're saying maybe that is something that can be moderated. So these bodies talk about safe or maximal levels of intake of individual sweeteners. Here in our recommendation, we are saying this practice of replacing sweeteners with sugars is not going to lead you to improve health gains, but you're getting in an area of risk that even if it's within the agreed safety level, is something that you may want to avoid.
All right, thanks. That's helpful context. So what are the policy implications of all this?
Some countries are already considering giving a warning on the content of non-sugar sweeteners in products. For example, what you have in Mexico, some countries might decide to give the same warning. So if it's something that should be at least not encouraged, so that could be a way to do it. Other countries, while using a nutrient profiling system, for example, for front of the pack labeling or for marketing regulation, may decide to include sweeteners in the list of food that should be avoided. And that's also happening again in South American countries. From our point of view, I think we would really like to give the message that the sweetness of food should be reduced. And the same way we are having a dialogue with the food industry about reduction of the sugar content of food, particularly in foods that are intended for young children, we would really like to give a message that we should reduce the content of sweeteners. That's possible, and not relying entirely on sweeteners as an alternative for the reduction of sweetness or the reduction of calories, but really looking at a change in the strategies in our daily diets.
Thank you. I appreciate that. To the extent one person can be instructive in this, 11 or 12 years ago or so, I stopped drinking diet beverages because of the very concerns we were talking about today and just switched over to tea with no sweetener in it at all. And I'm completely accustomed to that. I find it very enjoyable. And I find the things that I used to drink completely oversweet now. So people can get calibrated at different levels of sweetness, can't they?
Absolutely. In a sense, this is the same discussion we've had with salt. Our capacity to adapt is there, and it happens relatively quickly. People can enjoy food without having that enormous level of sweetness. As we know, sometimes the excess presence of other salt or sugar or sweeteners is somehow a way to cover the lack of good taste from the other ingredients. So good foods and drinks can certainly happen without the unnecessary addition of this compound.
Well, I want to issue my genuine thanks, Jason, to you and to Francesco for being with us today, but more than that, for doing this really important work. This feels like a watershed moment in our discussion of these sweeteners, and I can imagine there will be a cascade of effects all around the world as a result of this work. So we really appreciate you joining us today and sharing it. So thank you so much.
You're welcome. Thank you.
You're welcome. Thank you very much.
So our guests today have been Drs. Jason Montez and Francesco Branca of the World Health Organization. And thank you for listening. And special thanks to Deborah Hill for her fine work as producer of this series. If you'd like to subscribe to the Leading Voices in Food podcast series, you can find it on Apple Podcasts, Google Podcasts, or your favorite podcast app. Podcasts and transcripts are also available on the website of the Duke World Food Policy Center. This is Kelly Brownell.